My name is Kelly Donovan, and I am a peer specialist with Advocates in Action, Rhode Island. And here is the Disability Community Forum. And today we're going to discuss some updates, and I personally hope that we're able to, hopefully my being here as an individual who receives services will help encourage other individuals with disabilities who receive services to speak up too. So right now, hold your questions until the end. Attendees are muted and will be unmuted at the end when we have questions. And here I'm going
Can I just ask, is the agenda on the screen now for people to see?
Yes.
Okay, thank you.
And I'm going to hand this over to Kevin Savage.
Thanks, Kelly. I appreciate that. I'd like to thank everybody who's on the call for joining and taking time out of what is clearly a busy and hectic time for everybody. And we appreciate you getting on the call. We're thrilled with the response. We had close to, if not more than 100 people request to be on the call. And I just wanted to thank you for participating. I think this is really encouraging. We looked at your questions, a number of the questions that were sent in, and tried to adjust the agenda to answer as many questions as possible. But I do want to tell you that I'm sure there are a number of people who had questions that didn't get sent in. So my goal is to go through the agenda pretty quickly so that what we can spend most of the meeting doing is answering any questions that you have that you may send in through chat. They'll be monitored and open up the room, so to speak, for people to be able to ask questions as a majority of the time that we spend together today. So that's what we want to do so that we really take this opportunity to hear from people in the community so that we make sure that this is your time and not just my time to be talking. I did want to start though by introducing the team, the state team. So today we have with us Heather Mincy, who's the Assistant Director for Developmental Disabilities, Brenda Duhamel, who works on our team, functioning a lot of our projects, overseeing and seeing through a lot of the projects on the team. Unfortunately, Tracy Cunningham is not able to join us, but Jay McKay is here in her place. Ann LeClaire is here, and Susan Hayward. So, and Susan works on our transitions, and Ann works in a number of areas related to some consent decree work, and does a lot of our work in terms of communication and on the Therapy project, which is our database. So we'll get started. So I wanted to start with our updates. And of course, COVID is a lot of the work that we're focusing on now and making sure that we're working as much as possible with our agency providers and people in the community. But I wanted to give you some statistics. So it's no secret, you're hearing on the news what the COVID impact is, particularly as things have been heating up in the last several weeks. Right now, of the 291 sites that we have that are providing residential services, 31 are currently impacted. And in the last 14 days, 63 staff members and 33 residents have been impacted by COVID. So they're currently showing no hospitalizations, but I believe that that's just because the data at the Department of Health is tracking a few days behind what's being reported. So if anyone has questions on that, just hold your questions and we can certainly get to more specific data if people have more data questions. But I thought that's probably what you want to know for what's going on, what's happening right now. So I'll leave the data to that. Another update we got out last Friday was on updating visitation guidance. So there had been some relaxation in visitation standards for residential care, but we sent out on Friday a pullback on visitation and very, very strongly advising the congregate care providers across our system to suspend all visitation other than for very specific compassionate care visits. And I know this is really a hard time as the holidays are coming up. But because of the outbreak, the number of staff and residents who are being impacted, we thought that that was the best course of action to take. So we began implementing that right away. And we needed to move in that very, very quickly to keep this vulnerable population as safe as possible as things are heating up with the spread of COVID currently. And again, if you have questions, we can certainly talk about that as we get through the agenda. Some other updates that I'll give you is, I just wanted to acknowledge the concerns about what the impact is for long-term quarantining and social distancing for people particularly in residential facilities, but also on people who are self-directing or otherwise living at home, that this can be a really lonely time. So I would encourage you to work with your loved ones or yourselves if you are a person with a disability and you're on the call, to read bulletins that we put out regarding positive mental health activities that you can engage in. Some providers are doing virtual activities, so I would encourage you to participate in those so that you do get some kind of access to community supports. If you feel that you're not getting the kind of support that you need and you need to engage in another referral or work with another agency, please feel free to call your social caseworker and seek out information on another kind of referral or referral to an agency who can provide group activities online. We're working with Medicaid to verify that group activities can be billed to Medicaid, so there's been some lack of clarity and we're working to resolve that. But please feel free to ask any questions you need to on how you can get the services or your family members can get services that you need to be supported as we get through these winter months, which we're anticipating will be very difficult ones. We're working on CIS, and we'll talk a little bit more about that later, but we've gotten the CIS workers recertified, so that's been completed, and we're getting the CIS meeting scheduled on a secure Zoom line, a HIPAA compliant Zoom line. There are 241 CIS meetings that need to be scheduled, and the scheduling is underway, and so we'll be getting that done. I know that plan writing is also happening on Zoom lines, so I would just encourage people to remember that as you're accessing Zoom lines, just to be mindful of privacy conversations and to really do your best to make sure that if you can, to use compliant HIPAA lines so that your calls aren't being, that you're not using or engaging in HIPAA related calls that aren't, on lines that aren't secure. So try to be very, very careful about that. There was a question about keeping day programs afloat and preventing them from shutting down. And so we don't certainly want to lose any services during this pandemic. We know that services are extremely important to all people with disabilities and certainly to their families to make sure that they have access. We're strongly focusing on community-based program, and that will be our focus not only now during this pandemic, but also going forward, that we want to see that people have access to services where they need them and in ways that are much more individualized than they've been in the past. So we're going to continue to focus on community-based support and community-based programming to meet consumer needs going forward. The pandemic has changed many many ways that individuals might be utilizing their allocation for day fund supports. So if you have unused day fund supports and are interested in using them differently, such as to purchase technology or equipment hiring staff or changing services or joining a gym class, please reach out to your provider agency, fiscal intermediary, or your social caseworker for support in how to go about using your funds in ways that you haven't been before. There are flyers available that you can read that will help you figure out how to access those resources. Recently, the department approved supporting SLA providers to receive day support funding for providing services, day support services to individuals living in their homes. And so we're working on operationalizing that support. So in the same way that we've worked with family members, which is a new policy during the pandemic, to access day support funding for their adult child with developmental disability. We're doing the same thing to help support SLA members who in the past would have access to day programming outside the home. Since they're providing them the support inside the home, we're working to actually fund that support as well. We have a new initiative called START, capital all caps START, which is an evidence-based model that includes intensive training and certification of individuals as quote unquote START coordinators. And the Center for START Services will work with Rhode Island to develop a crisis intervention system for individuals with intellectual developmental disabilities that also have behavioral health needs. And the START coordinators provide crisis prevention and intervention services. Leadership in the department and around the state are very excited and on board. Funding is secured and a contract with the Center for START Services is in the works, so that we'll be getting that up and running. And we're excited because it works to train people in the behavioral health and mental health communities to specifically work to meet the needs of people with IDD. So that's very exciting. We want to talk about EVV, electronic employment verification, and I'm going to ask Heather. She's our resident expert on EVV, so she's going to give a brief update.
So EVV is the electronic visit verification system that individuals who self-direct their services and need full assistance for some of the services that they're getting would have to do, basically. So where we're at with this right now is EVV is set to be implemented with the January 1st of 2021 start date. It's kind of a soft launch because we're still working with the FIs and all the stakeholders to get people on board and people up to speed as to what needs to be done. So there are groups that are going on that are meeting to discuss some of these things. We just recently were working towards trying to figure out within our system of those, who are using the self-directed model, how many people would be subject to EVV. And we have, out of the 5 FIs, 4 have responded so far. And we do know that there's, through these 4 FIs, 37 individuals that will be subject to EVV. So it's not a lot of people within our system, but for those people who will be affected, we definitely want to make sure that they understand what it is and what they're doing and how to use this system. So there's, again, just work that's being done behind the scenes on that. We're also going to be putting out very soon a one pager on information regarding what EVV is and who would be subject to it. And that's pretty much it, Kevin.
Yep, thanks, Heather. Yeah. And Jay McKay is going to give an update on PSEP 3.
Thanks, Kevin. Just to give you an update on what Tracy and I have been up to, PSEP 3 is well underway, which is the Person-Centered Supported Employment Performance Program. We've got 4 projects that are working with us: Looking Upwards, Perspectives, 7 Hills, and Work Inc. PSEP 3 was designed around consent decree individuals who are part of the protected class. So that'll be youth exit, shelter workshop, and day, and individuals who have never been employed. So if people are interested in finding out more about this program, there is a flyer on the DD employment website section. There is also, as part of that flyer, there are some links. There's PowerPoint presentations from all 4 projects that you can look into. And there is also, thanks to Advocates in Action, we had done a virtual house of all the programs. So there is a recording link that you can also check out and get some more information. If you're not sure whether you're eligible for this program, you can contact myself or your social caseworker, so we can let you know about that. And if PSEP 3 is not something for you, then there are other employment programs that are still going on, even through COVID. We have many heroes that continue to work as essential workers. We have some individuals that have been furloughed, and we've had actually many job hires since March as well too. So a lot of good things going on in the employment. Another thing that had happened last month is we had Real Talk about employment, which was hosted by Ripon. We had a peer-to-peer group, and we also had a family-to-family group. That was on October 22nd and 29th. So they talked about their experiences and answered questions about those who are still hesitant about employment. So we will probably be doing a couple more of those sessions. So stay tuned for more information. And that's all I have for employment.
Great.
Thank you.
Thank you, Jay. Nice. So I actually gave this update. I don't have anything else to add on that. So I'm going to go to the consent decree. So under the consent decree, the court had issued an order identifying 16 administrative barriers that the department was, I'll say asked, but actually ordered to work on to relieve the burden that particularly providers need to use resources that distract them from providing the resources to people with disabilities, and instead use those resources to meet administrative requirements in a number of areas. And so what we did was we combined the 16 administrative issues into 5 work groups to try to address how we can relieve those administrative burdens so that resources can be freed up to provide the services to people and the resources where they're needed to provide services to people with disabilities. And so the 5 work groups are dealing with the barriers that are related to fiscal concerns, eligibility, appeals. So when people want to appeal funding or a decision made by the department, contracts, and that by contracts, it's how a person sets up from their ISP to how they actually get their services met by a provider. So they're basically their PO plus their ISP is what we call the contract. And then individual budgets, how someone's individual budget is managed between them and either the provider or the FI. And so those work groups, they've been meeting every week. There's some subgroups and work groups as well to try to get to the bottom of what we can do to relieve all the fiscal issues that families and providers and individuals are working on, and their work kind of gets bogged down on. And we have a responsibility to report to the court every 2 months. We do that. And we've had 2 reports that have gone out so far. We're sort of at a midway point. We're trying to get all of the decisions and recommendations out by the end of the year. Later this week, we have a sort of midpoint meeting where all of the groups are going to get together and discuss where they're at, make sure that we're heading in the same direction, because there's a lot of interaction that happens and overlap that happens among the groups where what decision one group makes is going to impact another group. So we want to make sure that we're not working in a manner that's counterproductive, but we want to be heading in the same direction. And the groups have a good cross-section of representation among stakeholders. We have people with disabilities on the group. We have family members in the group, advocates, obviously members of the state, different state agencies. So BHDDH, EOHHS, Department of Human Services, all providing the information so that the right expertise is there to be able to get decisions made, questions answered, and keep the progress moving forward. So I'm not going to get into the details, although if people have questions about the details, I'm certainly willing to do that. I have the last court report here in front of me. But I think the main gist of what I want to get out to this population is that it's important that we recognize that the more we're bogging you down with administrative burdens, the more we're distracting and detracting from people being able to provide services to the people who need them. And that's what we want to address. So that's really the main issue with the work groups. That's really all I had on where we are with the consent decree. We're working hard. We have a great group of people working together. I think it's significant amount of cooperation between the three agencies involved: ORS, RIDE, Rhode Island Department of Education, BHDDH. We work extremely well with the court monitor, and we've had excellent leadership. Brian Goslin has been leading the team and for the past, I would say, year. And I'll just ask Brian if he has anything that he would like to add at this point.
Hold on, I'm gonna make him a panelist because he's not yet.
Okay.
Or Michelle's gonna, I'm not sure if I, Michelle, you have to.
He's all set.
Here we go,
Yeah.
excellent.
Hi, good afternoon. Nothing in addition to add, Kevin. I know that there's been a ton of work out there and new reports from the monitor that are really outlining the pathway for the next 3 years to the end of the consent decree 2024, which is what we are all aiming towards, making sure that the system is in compliance with what the court has ordered, but also it is centered around the person, which has been the main intent of all of the work around integrated day employment services in particular. So I talk to many of you on a regular basis and appreciate all the support in my interim role as the consent decree coordinator since for actually almost 2 years at this point, believe it or not. And we're looking forward to providing some additional resources to the consent decree as we move forward. So nothing in addition to add, but always here for any questions or outreach that the community or providers have. So thank you so much.
Great. Thanks, Brian. So the next issue is conflict-free case management. A working subgroup of the Quality Advisory Committee, which meets monthly. The Quality Advisory Committee meets monthly, but the subgroup, I actually don't know how often it meets, has been charged with developing a recommendation for a conflict-free case management model. And the group is fleshing out details for each federally required component of case management to include a purpose, set of expected activities and tasks, and provider standards. A timeline of 8 weeks has been established to complete the task. So I'm going to guess they meet every week. But Brenda Duhamel is here. Did you have anything you wanted to add to that, Brenda? Brenda leads the charge on this. So I wanted to just let her add anything she wants.
Sure. Hi, can everyone hear me okay?
Yep.
Yeah, so that's spot on. We're working in a small work group. We then will present to the Quality Advisory Committee. And we're also working with a group from OHHS that works sort of looking at the system for all the folks on long-term services and supports, and to see how conflict-free case management could work across the entire system. So we're in a couple of work groups to go through those things and to see what makes sense. We're hoping to have some product by the end of this year to present.
Okay, thanks, Brenda. There were some questions about technology, and so we had some funding from technology and to help people to purchase technology from the previous fiscal year, and we moved that money forward to this fiscal year. Oh, actually, that's a different issue, so I'm going to say that wrong. But there is funding available, sorry, for helping people purchase technology. And there's a request to itemize what services such as technology can be purchased. So we are working to get that kind of information out to people, but I did want to remind people that in a system where we're trying to make things and working to make things individualized, there's really no exhaustive list because we always want to be able to consider individualized and individual requests and work with Medicaid on how to fund those requests. So I appreciate the question on can we get a list out? I think we can get a list out that refers to types of things we can buy and specific things we can purchase. But when an individual has a question, I want people to really think in a way that identifies this is what I need. And can we talk about that rather than just going down a list and saying, it's not on the list, therefore we can't do it. Let's keep the conversations about the needs of people very, very open rather than just referring to lists. So we'll get it out because I think that is important, but keep the conversation expansive. And we certainly are. This pandemic has exposed, I think, very clearly the need to use technology and to make technology as available as possible to people out in the community and to keep particularly visitation so that people have a way of visiting people when person-to-person visits can't happen. We also want to be sensitive to the fact that not everybody can use technology. So we want to make sure that we're addressing what to do when people aren't able to use technology and not merely rely on technology. So we want to keep also that conversation very expansive so that we're meeting everybody's needs. The last section I think that I had was on budget and funding. So I think I'm probably going to defer a lot of that conversation to the next community forum because we don't have a lot of answers on the budget yet. So some of the questions are anticipated funding cuts. We don't know what's coming. So we don't have a budget that's been approved yet. So I'd rather wait until we have a specific and approved budget before we get into speculative conversations about the budget. So if you have questions, I'll take specific questions and see what we can answer. But at this point, I think that I'm going to delay the conversation on the budget until we have something more specific and concrete to work on. And then I'm going to turn over the conversation to Sue to talk about progress on transition services.
Sure, thanks, Kevin. What happened was we had received a question about what progress has been made in improving the DD system from transition services and beyond. So what I'll be sharing with you is some things that are already in existence, but also some things that are new since the last community forum. So one of the things that we've been doing for quite some time is working very closely with the Department of Education, Office of Rehabilitative Services, and Rhode Island Parent Information Network to create an annual collaborative state plan. And that state plan addresses transition planning and services and guides our shared work in multiple areas throughout the year. We also participate in local, regional, and state transition advisory council meetings, and those provide an opportunity for educators, state partners, family advocacy organizations, and adult service providers to share information. We also provide adult service information to students between the ages of 14 and 22 in all public, private, and charter schools throughout Rhode Island through our participation in IEP meetings for students with intellectual and developmental disabilities. The information that we share is also available on our recently updated transition services page. That page was actually updated this morning, I'm happy to say, on our BHDDH website. So all our transition related materials are translated into Spanish. We also have a Spanish phone line monitored through our contract with Rhode Island Parent Information Network. And that page also includes links to state and national organizations that provide information regarding transition. As many of you know, we have an eligibility by 17 policy. We've had that in place for several years now. And that has led to an increase in students eligible for adult services several years prior to exit from school funded services. So that has actually allowed for improved transition planning with the student, their caregiver, and the IEP team. What we've been able to do is assign DDD social workers to eligible students at least 1 year, but most often 2 years prior to their exit from school-funded services. All our social workers have undergone training specific to transition services, and they're also provided ongoing information and resources for that work. Also, together with the Department of Education and ORS, we provide presentations to over 60 schools annually to introduce adult service options to educators throughout Rhode Island. And that, again, is for educators in public, private, and charter schools. We also, in collaboration with ORS and Department of Education, participate in 3 project search sites, which provide school to work services for students in their last year of schooling. We've also started, this is some of the newer information that I have, we've recently started a transition community of practice with representatives from adult provider agencies with the goal of increasing communication with educators across the state. One of the initial steps has been to collaborate with the Department of Education to hold what we're calling provider chats, which are opportunities for adult service agency staff to communicate directly with educators through facilitated conversations. So through that group, we'll be doing a number of things, some of which include sharing resources and training opportunities. And we anticipate that that group will be meeting quarterly throughout the year. Following really a great deal of input from families, educators, provider agencies, and social service staff, we've created a transition timeline for caregivers. And that timeline provides benchmarks for steps to be taken as students move through the transition process. We've included that timeline as part of the information packet that we share with students and families during the IEP meetings. And that timeline can also now be found on the transition page on our website. And we've also done outreach to children's organizations like the Cedar organizations to reach a younger population and provide information regarding the process of transition and transition services.
Okay. Thanks, Sue. I appreciate that. So that's all that I had for our agenda. And I know that there are a number of questions in the chat room, so I think Michelle's going to help manage those.
We have questions in the chat. We have a couple in the question and answers. And there's a couple that looks like possibly from the notes that were sent in ahead of time. There might be a few that we didn't totally hit. So from the question and answers, the first one is just wondering, we're just going to go as they come up. Just wondering, once a purchase order is created, approximately how long does it take for the SLA to receive the funding?
That's a good question. So Heather, do you know the answer to that? How long it takes to get through
So
fiscal?
there's no, so I don't have a specific answer on it. We're working with the provider agencies right now. If the question is in regards to the enhanced SLA stipend, we're working on that right now. Hopefully it is going to happen soon. But again, we're in the process of doing that, so I don't have an exact date. But it won't be much longer. That I can assure people, it will not be much longer.
Okay. The next question is, what are you hearing about public transportation barriers to employment for people with disabilities? Are others denied taking transportation to work for COVID fears?
So,
Heather?
okay.
Yeah.
Well, I would just say, and I'm just jumping in because I know, there was a group meeting earlier over the summer to talk about the transportation issues related to COVID. So I wouldn't say anybody's been denied transportation. I mean, I think that there are individuals who are choosing not to take, the public transportation. I also know that RIPTA has their own precautionary measures in place. It may be that they're not, they're taking less passengers because there needs to be, certain space on the bus, whether it's the regular RIPTA public bus or the ride program as well too. So there are precautionary measures that are put in place, but I don't know that anybody is being denied access to transportation.
Okay, next, do we know how many SLAs have had the opportunity to be funded through this new funding program?
So I don't have an exact, I don't know off the top of my head. I was trying to look for that quickly because I saw that question come up. So I want to say it's like over 120, but I don't have the exact number right now.
Can you just explain the new funding program really quick, just in case that was a piece of information? That's just the enhanced.
So it's it's an enhanced stipend. So as Kevin said before, for SLA providers who are now, find themselves home from work and, just working more with the individuals throughout the whole day versus, somebody who might have been going out getting community-based day support somewhere else. We put in place, this enhanced stipend because at this point in time, they are just, doing more with the individual within the SLA setting.
Okay, the next question, what outreach is there to homeschooled families which may have children with disabilities that are not met through public education path? For example, such as a student that is 22 and not yet serviced by transition program, and is that too late?
Okay, I'll take that. We know of students who are receiving schooling through the Department of Education and the local school district who invites us to the IEP meetings for students beginning at age 14 who have an intellectual disability or developmental disability. It looks like they may need adult services. So I would say if you're in need of some transition services, actually, if your family member is 22, they have probably already exited school-funded services. So they would need to apply for services through the Division of Developmental Disabilities. But anyone else who is homeschooling their children, if your family member is under 22, then please definitely communicate with the town in which you live, the school district, in order to make sure that we are aware of those students. You can also certainly email me or call me, and I will put it looks like I can probably put my email address in the chat here.
So speaking of the chat, just so people know, if you are able to put your questions in the question and answer box instead of the chat box, they'll be easier for us to find them. If you're not able to, then put them in the chat box because Michelle and Kelly are looking there also. I think that Anne might be looking too, hopefully. So the next question ties, and we'll still get the questions in the chat, so don't worry. Let's see though. The next in the question and answers is there a process in place for acquiring PPEs for just direct support staff that work for self-directed individuals?
So you want me to take?
Go ahead.
So for the self-directed individuals, the process that we still currently have in place has not changed. It's, individuals have been reaching out to their social caseworker at this point if they need something, and their social caseworker has been making the, the connection so that that individual is able to get PPE. We were trying to work through the agencies to do that, but we still haven't gotten a finalized process to make that happen. Part of it just because the agencies are overwhelmed, themselves right now too, with finding staff to do just the basic support. So right now it's still the same as reaching out to your social caseworker.
And then here's one more. We're going to get the ones in the chat, but how will situations with SLA day enhancement be handled when day programs choose to close after request has been sent in and then reopens for a short period of time and then closes again? Does a new request need to be submitted every change that occurs?
So a new request, yes, and any change in services, a new purchase order would need to, to come in because in the system, we would have to update that. So whoever is actually providing the services is getting paid for that. But I also want to say, just because, I didn't see the full question, but just in hearing how you read it, Deb, I just want to also let people know that, if their day program opens, but they still feel comfortable getting, kind of those holistic supports with their SLA provider at this point in time, they don't have to change. That truly is somebody's choice. But if they want to, then yes, they are able to do that. And there does need to be some, a PO sent in so we can update it in the system.
Okay. Here's a couple more from the questions that I wrote down before I looked. There's one that is with vaccines on the horizon. Are plans underway to roll those out to people with developmental disabilities? And where would people with developmental disabilities fit in priorities for vaccination?
So I'll answer that. So at this point, so obviously that's something that we'll have to be working with our partners at the Department of Health on, but I am not aware of any process in place yet, but that will certainly be a high priority as vaccines become available.
The next question was just,
Get more information out on that as it becomes available.
one of the
And
questions was.
let me just say let me say one other thing. As we talk about vaccines, there is a process in place that's being worked on, and we'll get more information out on this, for surveillance testing to be occurring in the residential facilities. And our Dr. Daly here, who's the medical director at the department, will be the prescribing physician, so that the providers will be able to get the orders for doing surveillance testing in the facilities. And so Tina Spears has really taken the lead on getting this organized. She's done a great job on it, working with the Department of Health on getting that organized so that they can be done at programs and we can get more testing done. So she's done a wonderful job. And so we're cooperating and working with them to get that in place.
One question that was asked in the chat and then back in the question and answer is also just, was the agenda item on coordination of Medicaid applications missed?
No, I didn't even realize it was in the agenda. So yes, I guess I did miss it. But so Tracy Levesque, who is not on the call today, is working with Department of Human Services, and I'm going to speculate OHHS on this issue. So she's not here today to report out on it, but there is continued effort and that's actually also, there's some work in the work groups on combining and working to reduce the burden on people in terms of how they apply for services and being able to get a system in place where information can be shared across agencies so people are not having to repeatedly provide the same information across the systems. So we'll get more information out on that as this process develops over time.
One question that was asked and answered was just, what does START stand for? And the answer is clear: Systemic Therapeutic Assessment, Resources, and Treatment. There's a mouthful. That's why they call it START.
That's why they call it START. I would not have been able to answer.
I know. Thank you for Claire. Claire did that. So another one, will the joint meeting, the one for the work groups, will that be open to advocates to listen to?
No.
Okay. They can get information about it.
So what we're going to do on that so that it is public is we're working to get the meeting minutes put on our website so people can read them.
The next question, going fast here. 2020, another question, that's a comment. Has there been a system developed yet for people who self-direct or live with their families? Oh, you already asked that, for procuring PPE. We already got that one, right? About protective equipment. Is there a system for that?
Just tell me what you're asking again. I'm not
The
sure.
question, I think you already answered this in the other.
I think I did, self-directs. Was that correct?
Just people who self-direct or live with their families to procure PPEs.
Yeah, we did.
And then somebody wanted to know if that conversation be with agency provider services or caseworkers to talk about that. Probably a person by person.
Caseworkers, yeah, they would reach out to the state social caseworker so they could coordinate it between the individual, their family, or whoever else needs to be involved to pick it up and to try to find out what exactly they need to.
You might have talked about this one, but has there been any discussion as to provide funding to train individuals on using technology? I think you talked about that people could put that in there. They could do that if they wanted.
Yeah, so there is a code, yes, that we did identify for training for technology.
So another person wanted to specifically know how to do that. So could you make information about that available? I don't know if you have a training on that yet. It says, how could I extend my plan to pay for technology?
Yes, we can.
It's more than you could probably fit in now, but we could offer something about that. How can we highlight or make it easier access to Sherlock Plan Medicaid buy-in as a visible option for folks who are working?
So can you say that question again?
Sure. Yep. How can we highlight or make easier access to Sherlock Plan Medicaid buy-in as a viable option for folks who are working?
So I think all the efforts that are going on right now with, Medicaid and their long-term support services, we are trying to get more information out through the No Wrong Door. We're working with outside vendors so that, the OHHS website, DH website, our website has clear information about all the different programs, that are available to people out there. So I think that I feel like just for DD specifically, I think when people are working, Jay, Tracy, Ann as well, through the benefits counseling, we really try to get that information to people. So I would suggest that people are going through benefits counseling as well too, if they're working, because all of that stuff will be explained to them. When they are meeting with a benefits counselor or even getting any information on benefits counseling. I don't know if Jay or Ann has anything else to add to that, but that's the way that they're going to get the most comprehensive information too about their eligibility and it affecting, their working affecting their eligibility in any way.
Ready for another one? So the next one, when you talk about numbers of people impacted by COVID in group homes, are you including those quarantining because of a possible exposure?
No, the numbers that I gave were specifically about COVID positive individuals, not people quarantining. So thank you. That's a great clarification.
Mm-hmm. Another person said, just as a comment, said RIDE is not transporting unless person can guarantee other transportation should they get symptoms during the day.
Can you say that again? So are they asking?
That's what I'm not sure. It says RIDE is not transporting unless person can guarantee other transportation. Unless person can guarantee other transportation, they should get symptoms during the day. Should they get symptoms during the day?
Day?
Right. So they won't drive you somewhere unless you can guarantee you have another ride. I'm not sure.
If you were, go ahead.
I was just going to say, I have not heard that, and we did meet with RIDE, the people who manage our program at RIPTA, and that is not anything that I have heard. So if there are certain people who are denied.
Heather, I'm sorry to interrupt. I think we need to look into that because I have heard that if someone becomes symptomatic during the day, RIPTA won't provide the ride home.
Yes, that I have heard.
Yeah.
So that's what the question is.
It was a comment. It wasn't a question. It was a comment from Claire. And she said that, so you have to be able to guarantee other transportation.
That's what I don't know. That's the piece I don't know, unless you know different, Ann. I have not heard RIDE say you have to guarantee before you get on this bus that you would have an alternate means of getting home. That I haven't heard.
No, they haven't. They don't ask for the guarantee, but they make it clear if you're symptomatic, they won't pick you up.
This comment from Claire said that they have to guarantee it. So that might be.
That's why I was trying to clarify that, because that I have not heard.
But the issue that Ann said effectively makes, however they stated it, makes it accurate that if they take you one direction and you become symptomatic during the day, you have no way of getting home.
No way of getting home,
So
exactly.
you need to have you need to be able to figure that out because you won't be able to get back through RIDE if you develop symptoms during the day.
Another person is just commenting.
I was just going to say to clear, that is something that with some of the agencies and some of the stakeholders we had talked about, because we knew that was going to be a concern with RIDE, is that they would not be able to take people home.
And speaking of public transportation, another person is just sharing, Carrie Clark, just sharing that taking public transportation, it still remains difficult with COVID. The front seats are often not available to you. So that's just another comment. And then, let's see, there's some links and stuff in the chat. So you'll be able to see the video of this, the recording of this, and we'll put the text up, the chat box text also, because you can see some of these questions and you can see the contact information that people shared. So you can contact people that are from the state here. Well, allowing family members to get paid continue past COVID? Can you still pay family members after COVID?
So we don't know the answer to that yet. That it is our goal to get that approved, and we're working with Medicaid, and we'll be working with Medicaid to extend that beyond the pandemic.
Keith is monitoring this. Keith, who works for us, Keith Wilcox, and he just said that people on Facebook, they're not posting questions, but you can do that. He's going to look for them. So if you're watching this on Facebook and you have questions, you can put them there, and Keith will make sure we see them here, just as a little note there, so you know. Another question is there?
Let me just follow up on what I was saying. So the reason, just if people want to know why would you extend it, the philosophy behind that is, in terms of making individual choices, it allows the individual to choose whomever they want to provide their service. So that's why we would want to extend it after the pandemic.
Back to transportation, Claire just wants to specify that they will not get you home, which is that was the concern.
Right, Claire's correct, that's correct.
Another question, is there a general sense of how many agencies are providing day services in these COVID days? Are the state caseworkers or ORS still involved in any furloughs or cutbacks? I guess that's two questions.
I don't have that number in front of me right now, but we do know that answer. So we could certainly get that out when we post information, so.
Is the start date for enhanced funding go back to August? That's
Yes,
the way.
August 1st.
Okay. Can you
For the first round. So if you haven't applied now, no. But for the people who have already applied, yes, the initial round. Otherwise, it will be going forward.
Can you clarify if an S-109 needs to be submitted for day enhancement for SLA or just the updated purchase order?
In S-109. Not a purchase order. You don't need a purchase order, just an S-109.
Has there been an increase in BHDDH caseworkers? Who can I contact when caseworker does not respond?
I would contact the casework supervisor.
Who is?
And also, in doing that, some people are reluctant to contact the supervisor because they don't want to create a tension with their worker. It won't create tension. It's not a problem. It's not getting them in trouble. Everyone knows how busy everybody is. And so if you're not able to reach your worker, it's fine to contact the supervisor and they're not in trouble for it. It's not meaning that they're not responsive, but, and I'd also remember that the pandemic is affecting a lot of people. So it may be, we don't know why they're not getting back to you. So please contact the supervisor if you're not hearing from them.
And how do they contact the supervisor?
By calling them.
But is that just, should they know that information?
I think so. Is that right, Heather? That
Yeah, I think some people should, but some people might not.
So they can just call the division if they don't know.
Yes, I would say just call the main number.
Maybe the DD Ask email.
No, yes.
Okay.
So if someone attended a program such as Cornerstone, which is a non-DDO agency, can day funds be accessible for the SLA contractor for day enhancement as they are now providing day support?
Yes.
That's nice. Are there specific criteria for the SLA providing day supports required to qualify for the enhanced funding?
Yes, and that is the agency that you're working with has that information and can provide it to the SLA provider.
Has the waiver for family members who live with self-directed support clients to get paid for direct service work been extended beyond February 2021?
It's for the duration of the pandemic, I believe.
Yes.
Yeah. For the state of emergency, yeah.
Is there a limit on how much money can be spent on assistive technology? It's probably an individual question.
Yes.
Somebody said, I missed the number of positive individuals in group homes. Could you say it again? Thank you.
Yes. So in the last 14 days, there are 33 residents who are currently impacted or have been in the last 14 days. If people want to know, since the beginning of the pandemic, there have been 143 individuals who have been impacted by COVID since the pandemic began.
that the other part of that, it's not that question, but just a comment. There's that many individuals, but the number of direct support staff is a lot higher than that, right? There's
Yeah, so in the last 14 days, 63 staff have been COVID positive.
staff need a big heroes
Yeah.
board.
I don't think we tracked staff from the beginning, so I don't think we could tell you how many overall.
Somebody said that wants to know what SLA stands for, shared living arrangement.
Shared living arrangement, yeah.
Let's see how, then back into the chat box, there are more questions. Here is questions or comments. So ORS does not have furloughs, but we are still quote closed lobby and limiting community-based work during COVID. That's just from Joe Murphy, so people know that. And then how do consumers know who how do they know who their casework supervisor is? Okay. You can call DD, you said, if you don't know, right?
If you don't know, call the main number and we'll find it out for you. Or even just to make it easy on you, the way that we'll instruct is that if you call and ask, we'll get the message to the supervisor for you and have the supervisor call you back so that you're not having to make an additional phone call.
Mm-hmm. So another person is concerned about gym membership. Should gym membership be promoted at this time when the governor may call another lockdown starting next week?
I saw that come through. Excellent point. So I was reading that off as a list, but I didn't intend it to be an encouragement to get to the gym during the pandemic at all. So thank you for pointing that out.
It's about making informed decisions, right? Like you have to think about what you want to do. Just because you can do it doesn't mean you should. Like, can you repeat information about receiving the day enhancement and time frame for requesting as of August?
Can I just say, I think that and jump in, Kevin, afterwards if you feel differently, but I think that if there's people who are interested in it, they really should contact their SL provider and they can give them full details on what they would need to do to work with that SLA provider agency.
And all of these questions, because some people said you missed the question or you missed the answer, you're gonna have this available, so you can see all of the information and probably with even more details as needed to just explain things. That's accurate, right? That's not saying things for you. Then I think those are all the questions that were in the boxes. Did people have more questions? No, I think that from the questions that people sent in. Does a technology committee exist to evaluate new technologies for being proposed or used in other states to help those in our community today?
So no, a committee doesn't exist, but I forgot about that question. That's a great question. So we thought that once we get through the work group, court work groups, we would form a committee, I think. So one doesn't exist, but we think it would be a great idea to have a committee, and we will form a committee in the new year.
Did you cover somebody wants to know, are there any, just as far as people being very stressed, one of the questions was any hope for respite for people? Can people use respite to get some relief? People are stressed out. Want me to read the whole question from the?
No. So I can answer that. So respite still exists. We haven't canceled respite or terminated respite. I can probably say that it's more difficult to access respite given who's able to provide respite, but it's not a service that's been terminated.
The people who weren't using it before, can they access that?
It needs to be part of your plan. So I'll let Heather speak to it specifically in terms of allocation for respite, but I'm not aware of if everybody gets it or not gets it, but it would have to be, there'd have to be an allocation for it.
Yes, there would have to be an allocation for it, and not everybody does get respite, but I mean, if people had it and they want to use it, whether, in an SLA, then yes, they can still use. So in the shared living arrangements, people, get respite services. They can still use those, and people still have been utilizing their respite services.
So for example, if somebody isn't able to get the supports that they usually got, like other day supports, could they use more respite to meet the, if they had some.
Yes, they
provide
could move
respite?
money from their day program funding into their respite line item, yes, and get increased respite supports if that's what they need and they have somebody who's willing to provide those supports for them. Yes, absolutely. And we have had people do that.
And as far as, this was a question that came up in conversations I've had with people, it's not written down here, but as far as the technology, you can purchase technology. Is there a way to purchase internet access?
We're still working on finding out that specifically. More and more states we're seeing are able to do it through CMS. So we just need to figure out the ways to make that happen.
Is it a matter of, because it's a monthly payment, like if it was a one-time payment, would that change it? Like if you could pay for a package?
So from what I've seen in the research that I've done, and I'm not going to say, I'm not an expert in this area, but from what I've seen, one of the main issues with it is who's accessing. So if you have it, it needs to be for that individual. So we know that people can have devices, their own devices, where they have internet access that just device. So that's really what we're looking into.
Oh, so I have an example. There's Wi-Fi hotspots that you can purchase that you come with a plan, but it's like a person gets that and has it, they use it for their device. So that's, you probably don't know exactly, but like that might be something.
I do know about the hotspots too.
Okay.
Yes, that would be something. So we just have to work through that and make sure with Medicaid and, that it's in our waiver and it's not something
Right, so it's not paying for your whole house to get cable, but you could.
Yes.
Yeah.
Exactly. And that it's written into our waiver so that we can pay for it as well too. That's the other part of it.
Going back to the questions, there are now some more entered. People were saying they didn't hear the question about the limit to assistive technology. People have had conflicting answers. If there is a limit, could you state it?
So there's not a limit, but it depends, of course, on what people are buying. So like I think Kevin said before, it's very individualized, and it is. It depends what the person needs, what they're utilizing it for. It needs to obviously be attached to their goals that are in their plan and be giving them either greater access to the community or assisting them with employment or building some, skills.
Mm-hmm.
Again, it's individualized. I can't say, there's like a $5,000 limit because we haven't put that on it. It depends what somebody needs.
And the funding for that comes out of their
Yes, it comes out of their plan. So that's the other piece of it too. They can purchase this technology, but yes, it is going to draw down on their service dollars.
But it would help you in other ways for those,
Yes, exactly.
Service that.
So that's the balance. Yes. It's hopeful that will provide you with, some additional support. So maybe it can help you to become more independent.
So the smart home technology fits into that package too, like things to help you turn on the lights so you don't need a staff person to come and flick them on and off and that kind of stuff.
Yes, it does. If that's something that somebody needs, we have had some people who have asked for that, not a lot, but we have had some, and people have bought certain things for their home to help keep them and remain independent within their own home.
Somebody, you said there's more technology. People are very interested in technology. You said there's technology funding available. Is that funding above or outside the normal tier package? I think I might have just asked that question.
Yeah,
part of your support.
It is within their tier package. Yes.
What are people doing about trainings for SLA and respite workers and direct support staff, i.e. CPR, first aid, etc., given COVID?
I think that's a question that they would have to ask their agencies. Kevin, I don't know, do you want to jump in? But
a little bit. So agencies are working to provide as much training as they can, but they're also working with our regulatory office to waive trainings that can be waived that aren't safety related. So it really kind of depends on what the training is, but they are all trying to keep up as best they can with what training can be done. Some things are being done online so that, so obviously during COVID, you're probably not going to be practicing with a whole bunch of people in the room on what normal CPR training would be looking like. But most of the agencies, if not all of them, are doing some kind of training in a virtual method to keep people up to date on the required trainings. But they're also working to get some things waived so that their primary focus, and this is really critical for providers, is focusing on providing services to the the people in their facilities. That's what they're really focusing on now. That's critical. And right now, particularly in the last few weeks where COVID has really surged, we want to make sure that we're not putting additional burdens on them that can be waived. We're wanting to make sure that we're allowing them the ability to focus on meeting staffing requirements and meeting service needs for individuals.
Mary Beth wanted to make sure that people knew that if individuals apply for free phone through the process explained in the weekly Buddha updates, there is access to internet on the phone. So to answer that question about being able to get online. And then Heather, can you explain EVV again and what it stands for? The
electronic visit verification system. So for individuals who are getting self-directed supports and need total hands-on care for some of those supports, like with their ADLs and those are basic tasks that it covers, individuals' ADLs. They would need to do this electronic visit verification where the staff has to check in at the start of their assistance with that individual doing those ADLs, and then they check out when they stop doing that. Because as we know, people who are self-directing getting a variety of supports, and EVV is only for in-home services, not anything that's done out in the community with the individual, and even within their home, any task that the individual is doing on their own or is learning how to do, so that they will not always need total care with doing those tasks. It's not subject to EVV. And again, there's such a small number of individuals, again, like I mentioned earlier. So far, there's 37 individuals in the self-directed system who are going to need to comply with this. So it's so small. So if you are one of those individuals, there will be targeted efforts to reach out to you, and the FIs are already doing that with those individuals.
So that might answer this next question. Are there funding areas in place to assist FIs with the implementation of EVV? Funding areas.
On that, yes. So I wouldn't say funding areas, but one of the questions that has come up, yes, is the training individuals, because the individual, the family is going to need to train their employees. So on how to use this system and what it is about. And so, yes, we have looked into ways to provide funding to agencies or the FIs who are going to have to do that.
I think this question might have already been answered, but are there CPR trainings available for self-direct support staff, payment through purchase order?
I don't know.
Yes, there are. So if people want to send their staff to a training, they can have it paid for through their goods and services line item.
If I requested the S109 funding back in August and was providing day services since March 18th, any reason why I would not be afforded the enhanced funding back through August?
Did they apply already?
If it says if I requested the S109 funding.
So it sounds like they did apply. So yes, we just, again, are working on how that is being paid out within the system.
And if people have like individual specific questions, they can contact you for more, because this
Yeah, I would recommend that they contact their agency if it's not a general question, because the answer is going to be specific to that person rather than to the whole group. So, but what I will tell you is we're not going to continue to go back to August. It's going to be a going forward. So we're not going to accept applications in December and go back to August.
Mm-hmm.
So it's for the application.
From when you apply.
The ones that were already submitted, yes. There were many that have already been submitted.
So if you apply now.
If you've already applied. Not if you apply now. If
right.
you've already
I mean, if you
applied.
apply now, it's not going back to August. It's going
right.
No.
That's, yep.
Go back to the beginning of time.
Right.
Heather, can I ask a question, just clarifying on the EVV for people? Is this only for home-based services that were originally home-based and not, COVID didn't change that? People are at home, right?
No, because it's only for individuals who need total hands-on assistance. So no, COVID has not changed anything. It's not, we understand that certain things might change or things might happen with individuals throughout their life, but it's basically around individuals who will always need assistance with some of their ADLs.
So it's not something brand new. It's just,
Yeah.
so this is another one, a comment or a question. Would it be fiscally more beneficial gaining technology as opposed to a gym membership, computer technology? I have to, besides that, so the question is, would it be fiscally more beneficial gaining technology as opposed to a gym membership? Isn't that kind of like person-centered is like what the person?
Person-centered, yeah.
Yeah.
So
So
each individual has to decide which service is beneficial to them.
Mhm.
I think it's probably the same person who mentioned the timing on gym memberships.
Mhm.
So of course, during the pandemic, we'd want to consider the timing, but each individual has to decide
Mhm.
with the support of their agency or their plan writer or whoever, what's in their best interest or their family input, whoever. But that's not a question we can answer
Mhm.
across every individual, what's fiscally better. So
Yeah. If you did, then there'd be no person-centered, right?
that wouldn't be person-centered. That's right.
Right. It would be agent sense. Yeah. I think that might be all the questions so far. Can you, if somebody didn't get a chance to answer, didn't hear their question answered, could you type it again or something?
I just want to remind people, I need to get off the call at 4:20. So
He's
Heather,
going
if
to
you
a
could,
party. Going
what's
to a big
that?
party? You're going to a big party, right?
Yes, I am. Yeah.
Yeah. Work. So again, this information, you're going to be able to see the webinar, the recorded webinar, and and the transcript of the questions with the answers. And if you guys have other things you said you could find out more about, you'll put that in there so that people will be able to look at this. If they couldn't attend or you missed some part of it, you'll be able to see that. Can people use, so part of the thing, you can buy technology. Could you use your funding to also buy like a class on how to, pay for a lesson on how to use the technology or some tech, they have those Geek Squad support things or something? Because a lot of times the technology part is a little intimidating. You're like, well, I've got this computer, but what do I do with it? So is that another option for?
Yes, it is. There is a way to fund training. It's something we were looking into because, we need to have codes for certain things that we're funding.
I mean, like they could take a class online or something, not, but yeah,
Mhm.
just like.
Yes, it would go under goods and services still within somebody's plan, just like the technology would. But yes, they can request that. Yep.
Somebody wants to know where you can see the recorded copy of today's meeting. So ANA will put it on our website and you guys will either link to it or you'll put it on your, wherever it'll be there, but there'll be several places to find it, right? I know when we've done it, we put it on YouTube so people can watch can have captions of it, and you can also translate it. You can, see the captions in different languages.
I just wanted to mention quickly too, just because somebody had sent me this message to say that there is CPR online as well, because I know some people were asking about that. I guess they're offering some online CPR classes too. So if people do want that, they could look into that as well too.
I wanted to, before I get off the call, just first of all, thank Deb and Kelly for hosting the call. Deb, great job leading with the
Keith, by the
questions.
way,
Appreciate it.
you can't see Keith, but he's over there in Facebook.
Oh, yeah, Keith. Oh, Keith, yeah, for doing the
Thank you.
Facebook. And I know Michelle did a lot of work to get this prepared. I want to thank the state team for providing answers to questions and helping prep for the meeting. And also for everybody in the community who took part in the call and asking great questions. Your questions help inform other people who may not have thought of the questions or who had the questions and needed to know the answers. So I just really appreciate everybody for your involvement in today's meeting. It was very supportive to everybody.
Somebody said a comment that technology needs to go under T5999, not goods and services. I don't know what that means, but I wanted to read it because it was there.
Thank you everyone for coming and being involved in this along with us.
Sorry, Kelly. P 5999 is the code for goods and services. So they're the same thing.
Ah, okay.
It's just a billing
That
thing.
throws you off if somebody's just sitting there saying, "Wow, that's what you have, like your social caseworkers and your FI and your plan."
It's
You
not
have people
something
to help you with that.
Just the people who do the billing would see that.
Yeah.
That's it then. Look,
Great.
you're not going to miss a thing, Kevin. Go to your party.
There you go. All right. Will do. Yeah, thanks so much. See you, everybody.
Bye bye.
Again, take-
Bye.
Bye-bye.
When he's gone, we can talk about him. It's done. We're done, right? This is good. Okay.